what can we do to make sure Washington keeps its COVID-19 cases down during the fall and winter?
You can elect a nurse to the Washington State Senate, someone who is willing to work with me in the work we need to do. Look, we need to convince people to continue to make decisions based on their own health, on their families and their loved ones' health, and based on science. And when you have a nurse who understands science and health, again, this moment calls out for a leader like Ingrid, who is both the knowledge on what works in public health and is willing to stand up for it. She has both of those things. We know we have to increase the number of people who will socially distance and will mask. And look, Ingrid is not a person who is, trying to have the support of Donald Trump here or the Republicans. And those folks are not the folks who ought to be determining what our policy is. We have a president who's caused, and we obviously hope that he will do well, health-wise, as well as Melania, and we hope that he will recover from his current illness. But we simply cannot have him or his party or those who appeal to his party, running our COVID response program, because they just simply want to deny and delay and won't be able to make the tough calls that we've made to try to reduce this virus infection numbers, which we have done. And we have had to fight Donald Trump and his party. And so we need somebody who's willing to stand up and support the efforts that have been successful. And we have been relatively successful. Our number of infections per 1,000 is in the bottom 5 or 10 on a given day of all the 50 states. So our ability to fight COVID, certainly I have a significant role on that. The legislators are as well, both in budgetary and policy issues. And I know that she is a person who's going to make decisions based on science and not a fear of Donald Trump or his party. So I need her to give me a hand.